All right, everyone, welcome to another episode of the Equity Circle podcast. Thank you for joining us today. We're excited to have a frequent guest on the show, talk about Omicron. So welcome, Dr. Steve Krager.
Thanks for having me, Lawrence.
Of course. I figured we could probably skip introductions because we've had you on a couple times, but if you want to introduce yourself and kind of more about yourself, you're more than welcome to.
So all I say is I'm the deputy health officer for Southwest Washington, so 6 counties in Southwest Washington.
Awesome. Well, we're happy to have you on again. Thank you so much for taking time out of your day. So I know there's been a lot of conversations about Omicron and what it is. So why don't we just go ahead and get started there? Can you talk about what is the Omicron variant and where did it start?
Yeah. So, I mean, I think most people are aware of variants, but just to kind of give an overview, viruses mutate all the time, especially certain types. And this coronavirus seems to mutate a lot. Influenza mutates every year, which is why we, get a different kind of formulation of the flu shot every year. Other viruses mutate, but some not as quickly as others. This virus is mutating partially just because it's infecting so many people in such a rapid, amount of time. So, something, a new virus like spreading across the globe is just, there's so much opportunity. We're talking about, trillions upon trillions of little viral particles being made and reproduced over and over and over. And whenever you reproduce something, whether that's a cell or a bacteria, bacterial cell or a viral particle, there's a chance for little errors to be made, right? And if an error is made, then that's called a mutation. And mutations can be, if they lead to, something significant changing in how the virus behaves, that can be a problem for us. And viruses can mutate kind of multiple ways. They can become less severe, they can become more severe, they can become less infectious, they can become more infectious. The push generally, and especially what we've seen with COVID-19 or the virus that causes COVID-19, is that they become more infectious, and that makes sense because the more infectious viruses will kind of win out over the less infectious ones, right? Because they'll infect more people once they kind of arise. They'll infect more people and then spread more efficiently. That's what we saw with Delta. That's what we saw with Alpha, and that's what we're seeing with Omicron. So we're not entirely sure exactly where Omicron came from. It was first detected in South Africa and Botswana about the same time. And most kind of the initial tracing links to those countries, but again, it can be really hard to pinpoint exactly where it comes from.
Sure.
But that seems most likely somewhere in kind of Southern Africa. And the thing we're most concerned about is just how much more infectious, transmissible, contagious, whatever word you want to use, Omicron is. And the reason that seems to be the case, so if you think of like anything that has a structure, whether it's a bacteria or a virus, there's things on the inside, there's things on the outside. Viruses have ways or little pieces on the outside that allow them to get into our cells. COVID-19, the virus that causes COVID-19, has something called a spike protein. And it's like the way that it like hooks onto our cells and then enters inside. And that's, how it infects our cells. It takes over our cells, it replicates, and then it explodes that cell and spreads throughout the body. And that happens over and over and over. So with Omicron, there's a ton of mutations on the spike protein, more than we've seen with kind of any other variant. And those mutations seem to allow it to kind of hook onto the cells easier, more quickly, which means, it grabs onto the cells more easily, it more easily gets inside. And if it does that multiple times over and over in your body, it just replicates a lot more quickly, right? And that's part of what we think, is leading to its increased infectiousness, contagiousness. Some of it might be also like where the virus sits in our body. So, if a virus goes deep in our lungs, we might not spread it as well as if it stays, in our nose, in our mouth, in our throat, where, when we cough and breathe and sneeze, it just more easily escapes our body, right?
Sure,
So that
sure.
there's some evidence that maybe Omicron lives more in our kind of nose and kind of upper respiratory system. So that's a little bit about what we know about the Omicron variant. And yeah, we're still learning a ton about it, and I'm sure we'll learn a lot more.
Yeah, and so just to kind of summarize, it sounds like it the variant can often live in places where it's easily transmissible. Is that kind of fair to say?
Yeah, and you bring up a great point. Like, why do these variants keep popping up? And the theory is, the more infections we have, the more opportunities for variants to pop up. And so if we just allow COVID-19 to continue replicating over and over and over, more variants will continue to pop up over time. And that seems to be borne out with what we've seen so far. So honestly, the way to stop variants from happening is to slow transmission of the virus. There's lots of ways we know how to do that, but it's hard to do that on a global scale, right? Because that's
Right.
really the only way you can slow it down. We could do the best job in the world in the United States, but if a new variant pops up in the other part of the world, we completely eliminate transmission in the United States, and then a new variant pops up that completely eliminates, our previous immunity, then all that work that we've done is kind of useless. So it's really a global issue.
Hmm.
So yeah, that's a really interesting point that we're trying to learn more about. Like, how can we prevent these variants from forming? That's the theory, but putting that into practice can be really challenging.
So we've talked about some of the transmissibility and what Omicron is. Can you talk about maybe if are there different symptoms of this variant than others? Are we seeing that in terms of being able to kind of identify if someone has Omicron variant of COVID-19? Can you talk a little bit about that?
Yeah, and it really this is very early data. Um, and it kind of depends on whether you're vaccinated or not too, or have previous immunity, right? So and that's the case with kind of any variant of COVID-19. If you already have some built up immunity, you're just more likely to have a mild illness. And that could be, maybe you just have a sore throat or runny nose or a headache, as opposed to like cough and fever and body aches, right? So more like systemic symptoms. Right now, among fully vaccinated people, cough is still very common. Runny nose, kind of feeling down, fatigued, sore throat. Those are the most common symptoms.
Okay.
It's harder to tease out people who have no immunity at all, but symptoms in general are also pretty similar. And so I want to kind of highlight, I guess, there's not like a specific set of symptoms that makes Omicron kind of unique, at least not right now. We
Okay.
Maybe it's going to cause a little bit slightly milder disease, especially in people who are vaccinated. That is still very much up in the air, but a lot of the symptoms are very similar to what we've seen in the past. So and it's a wide range, which makes it really challenging.
Sure.
Someone with just a headache could be from a lot of different things, right? People get headaches all the time. But if you kind of downplay that, that can be really problematic. You could potentially spread COVID-19 without knowing it. So try to not to focus on a specific set of symptoms.
Sure.
There's like 12 different symptoms that COVID-19 can cause: vomiting, diarrhea, body aches, fever, cough, runny nose, fatigue, sneezing, sore throat, all those things, muscle pain, headache. If you have anything like that, if you just feel kind of tired, honestly, I
Yeah.
think it's a reason to get tested. Absolutely.
Mm.
Especially if you're going to be around people who are, potentially more vulnerable, or just around people in general.
Sure. Sure.
Be safe and get tested. And so, there's some evidence that, maybe, especially like fully vaccinated people or people who are boosted who get COVID-19, their symptoms seem to be a little bit more mild, more likely to be completely asymptomatic, which can be problematic. But in general, there's not a huge kind of shift in what we're seeing with symptoms overall with Omicron.
Hmm. Well, you kind of touched on it a little bit, but it was something that I did want to ask is how this variant is affecting those that have been vaccinated, meaning they've had two shots versus those that have had their booster shot, and how it kind of differs
Yeah.
uh, in terms of how it's affected them. And then my follow-up question would be how it's affected those that have been unvaccinated.
Yeah. Yeah, I mean, that's maybe the question I hear the most. And just to quickly go back to the transmissibility piece, because I was thinking about that a little bit more. There's thoughts that this is like maybe 3 times more infectious, more contagious than Delta, which was basically as infectious as chickenpox. You just think about, I mean, we're talking about an infection that spreads really rapidly, really easily. One of potentially the most infectious kind of things that we've seen, just in terms of how quickly it infects people. We kind of think about measles. Measles can infect, the R naught can be like, 15, which means one person can infect up to 15 people if there's no immunity built up at all, or people aren't vaccinated or they've never had measles. That's really efficient. And Omicron, I don't know if we're going to reach that. It's really tough to tease out because we have so many people with previous immunity and who've been vaccinated, but it does seem to spread just really easily. I want to emphasize that. More infectious than Delta. Delta caused us a lot of concern because of how infectious it was, and so having that with Omicron is really concerning. In terms of how it's affecting kind of different groups of people, the good news is all the data that we're getting, most of the early data is coming from UK and South Africa in regards to, how it's affecting people who are fully vaccinated, people who are boosted, people who don't have any immunity. And the data that we're seeing is if you're fully vaccinated, you haven't had a booster yet, you're still well protected from severe disease, but you are not well protected from getting infected at all. And that might be important for someone. That means you personally are probably pretty well protected from like going to the hospital if you get COVID-19, but you could still pass it on to someone who's not, right? Who's unvaccinated or really, with a compromised immune system. So that might kind of play into, how you interact with people. People who've been fully vaccinated and then had a booster shot seem to be more protected from just infection in general, and even more protected from severe disease. So the booster is working really well. It is also not perfect, but with the booster, we get back to kind of protection we're thinking about with Delta, with we had with fully vaccinated people. Fully vaccinated people still got Delta. Estimates were, around 80% protection, as opposed to kind of the 95% protection we had seen before. So
Sure.
getting close to that 80% protection of just any type of infection, mild, asymptomatic, that type, being able to pass it to other people. So again, not perfect, but still pretty good. And so that I think you can gain confidence in that if you are fully vaccinated and boosted. You are certainly going to be less likely to transmit COVID-19 to other people. You're less likely to get it. It's still possible, but the chances are lower. But we are going to see a lot more. We're going to see a lot more breakthrough cases in people who just are fully vaccinated, a lot more breakthrough cases in people who've been boosted as well. But the numbers will be lower, especially for people who are boosted. It's a lot more complicated in people who have no immunity at all to COVID-19. They've never been infected. They've never been vaccinated. We don't have great data. Just looking at the UK is publishing kind of daily reports, and their report yesterday said that, again, very early analysis, but the same number of people are seeking out hospitalization, having symptoms, or asymptomatic compared with Delta, which makes me worry that these other reports that we had from South Africa that maybe it was causing more mild disease may not be true. And that those early reports were really colored by the younger population of South Africa and a lot of built up immunity in South Africa, either from vaccination or previous infection. South Africa is one of the youngest countries in the world, if I remember hearing correctly. So generally, they're just going to have more mild disease because they're younger.
Sure.
So the important point for me is that if you are at risk, which to me, I mean, I've seen hospitalizations have happened in really young people, but obviously, age 35 and older, we've seen, significant numbers of hospitalizations. If you're 35 and older and you haven't been vaccinated, that's going to be a problem. We're going to see a lot of people in that age group. Obviously, it's going to be more as you get older, but we're going to see a lot of people in that age group hospitalized, I think. And with how efficiently Omicron spreads, that's the population I'm most concerned about, and kind of our public health system in general. What does that mean for our hospital systems? Are we going to be able to manage a surge of that many people? How many people are going to die from this variant of COVID-19? Those are the questions we're asking ourselves and trying to prepare for, because it's a very real possibility. It's a strong possibility, is what I would say. The only other group we haven't talked about is people who are not vaccinated, but have had COVID-19 in the past. And that's also kind of we don't have necessarily really great data on. You definitely seem to be protected from severe disease, at least somewhat. It would be better if you got vaccinated on top of that previous infection. But you still seem to have some protection. There's some crossover, from past infections.
Sure.
But the thing that I tell people is that a lot of people have assumed, they never actually tested positive, but they assume that they knew someone who got COVID-19 and then they had symptoms and then they just assumed that they had it. That is a bad idea. There's lots of things, other viruses that have been circulating this whole time, and you cannot make that assumption.
Sure.
So to be on the safe side, I would get vaccinated. Absolutely. That is the safer thing to do, kind of no matter what. And then the other thing I tell people is that there's a huge variation in how our immune system responds to infections. Sometimes with COVID-19, we get a really strong immune response, and you have pretty good durable immunity that's going to last, and it'll protect you from severe disease. Some people don't have that at all, and they're still at risk of severe disease. So this by far the safer thing, and we've seen this with data over and over, regardless of if you've been infected in the past. Getting vaccinated and boosted is a great idea. It's the safest thing to do to just be sure that you are as protected as you can be from COVID-19.
Sure. So we talked a lot about transmissibility, and we talked a lot about the variant itself. Are there, especially as you've talked about testing, are there different tests that can distinguish or detect different variants such as Omicron, and how can we find that?
Yeah, that's a great question. I think the important thing we can talk about is that all the tests that we have here in the US right now, whether they're PCR or antigen, which is the more common like home tests, they will tell you if you have Omicron and you test with that, it will show positive, right? It's not going to tell you that you have Omicron necessarily, because that has to be done at a special lab that does genetic sequencing. But it'll tell you that you have COVID-19. So that's really good, because there's been some concerns in the past that variants, if we're not checking the right thing on the test, that we may miss out. But Omicron has mutations in a place where we don't actually test for. So a different part of the virus, basically. That's kind of the simplest way I could explain it. To get a little bit into the weeds a little bit, if you get a PCR test, some of those PCR tests do a little bit extra genetic analysis. That's not a full sequence. We're not looking at the entire genome, the entire genetic sequence, all the RNA of this virus, but it'll look for certain parts of it. And if parts of that are missing, it's a really good clue that that's Omicron. And so that is a rapid way to kind of give us an understanding of how much Omicron is out there. And the University of Washington, their virology lab has always been doing a lot of testing since the start of the COVID-19, and they do that test where they look for that kind of missing piece, and they've been seeing a lot we're talking like 50 to 70% of the tests that they're doing are missing that piece, which most likely is Omicron. So you're not going to find that out if you get tested. You're not going to be told that. But I will say we're at a point where, the CDC, I think, said almost 3/4 of their tests that they had seen were Omicron already. So, and that's going to change, honestly, in the course of a few days, is how quickly Omicron is spreading. So if you get COVID-19 within the next week, you can be pretty certain that it's the Omicron variant. Not 100%, still might be some leftover Delta, but even probably about after a week from now, if you test positive, you can be very, very certain that it's Omicron. So that's kind of how testing works. You're not going to be told, what variant you have. That's just not all tests get that full genetic sequencing. In Washington, it's about 10%. And even then, we just don't have a system to really share that data. But I think the most important thing is that if you have Omicron and you test, you're going to show positive the vast majority of the time. So our tests are still working for Omicron, and that's kind of the most important.
So it sounds like then that the biggest concerns and what we're going to see over the next few weeks is that there will be quite a bit of Omicron variant. So can you talk about, especially, we're recording this, it's December 21st, and, we're getting very close to Christmas and lots of holiday gatherings. And so I think one of the questions that many would have is what can I do to protect myself and others from COVID-19 during this holiday season? And does that change anything in terms of our holiday plans?
What we do. Yeah. This is a personal question, something that I have to personally think about too, right? So I've told people what, I'm personally doing with my family. And, I take great comfort in at least, my closest family around me and the people that I would spend time with. Everyone who can be vaccinated is, and everyone who can be boosted is. So adults, kids, and that makes me feel, I find a lot of comfort in that. Even if we, happen to spread COVID-19, which I hope to God does not happen, that the most vulnerable among my family would be protected. But there are things we can do to kind of reduce that risk on top of vaccination. Vaccination is by far the best thing we can do to reduce chance of, severe illness and disease and prevent infection. The other things that I've been telling people, probably the most straightforward thing to do is to take a test the day of your event. I know home tests are hard to find right now, and that's probably because a lot of people are having the same thoughts. But if you can find one, or find a few for your family, that is one great way to kind of reduce the chance of transmission happening at a gathering. If you're positive, you should not go. That's just pretty straightforward. You should believe that test is positive, whether you have symptoms or not. Brings me to the next point. If you have any symptoms that are concerning at all, you should not gather. The chance of you spreading is just too high with how much COVID-19 we're seeing in the community. Other things you can think about in an indoor space: ventilation and air purification. So opening a window, obviously it's super cold, but cracking a window, using your heater a little bit more, just getting more fresh air, it's going to reduce the chance. If someone happens to be infected, it reduces the chance of infection. If you're in a really crowded indoor space, especially with people, like lots of people from kind of outside your bubble or outside your family, masks are a good idea. I know people don't like masks, but they still work really well, and especially in crowded indoor settings where you don't have a lot of space, where ventilation may not be great, a mask is going to be really critically important. A well-fitting mask sits against your face kind of as tightly as possible and has as many layers as is comfortable for you, or something like a KN95. Let's see, those are kind of the main points. Get vaccinated, or take comfort in the fact that you've already been vaccinated and boosted. Take a test the day of an event. Think about ventilation and air purification. So if you have an air purifier, you could try to use that. And then masks in really crowded settings. Travel is a big one. Travel just really spreads COVID-19 a lot. So travel right now, honestly, is not a great idea, but I know people are still going to do it. So all those steps that we talked about before are still going to be really important as you travel as well. Get tested, wear a mask, think about kind of the air and ventilation in the space that you're in. Those are going to cut down the risks. We're still going to see transmission. And I think the last thing I would really implore people to think about is who are the most vulnerable in your lives. So there may be people who are either not vaccinated and high risk, or really high risk and their immune system is not great and they've been fully vaccinated or boosted. Those are people that I'm most worried about bad outcomes happening. So severe illness, hospitalization, and death. Just be conscious of those people in your life and things you can do to protect them. The things we talked about will help, but it might be for some people, it's not the right time to gather. I hate to say that because I think it's really important for people to have connections with people, for people's mental health. But I'm just worried, if you can postpone things for a little bit, if you can wait till someone's, had their booster and maybe it'll be a little bit more safe for them. Those are things we can think about. I'd hate this to be a lot of people's, last holiday season. That would be awful. So that's what we're trying to prevent. And hopefully we can do some of those things that we talked about and prevent a lot of spread during these holiday gatherings.
Well, Dr. Krager, I've really appreciated just your time and just talking through a lot of things related to Omicron. I really do appreciate it. I know that we will continue to learn as time goes on. And so for what we know now, I and what you've shared, we really appreciated it and hope you and your family have a wonderful holiday season. So thank you for joining us today.
Thanks for having me, Lawrence. I really appreciate the opportunity to talk to you, and we will get through this.
We definitely will. And so thank you so much. We've been listening to Dr. Krager from Deputy Health Director in Southwestern Washington region. We thank you, listeners, for listening to another episode of the Equity Circle podcast. Please subscribe and share with your friends and family. And lastly, remember that equity equals progress.